Hi everyone, I'm Dr. Rose. I'm a board certified dermatologist here in New York City, and I'm going to talk about hair loss and hair restoration. As a dermatologist, hair issues and hair loss is something that I see every day. Hair loss is a big thing. When someone identifies with their hair, when it's part of their personality and their identity, losing it can be really, really harmful. And it can really be devastating. Now, I have plenty of really amazing patients who are going through chemo or have alopecia totalis and universalis, who are rocking their cue balls and they're totally awesome. I mean, this is New York City. We have people with the biggest personalities here. But for those of us who really enjoy our hair and use it as part of their expression, it can be devastating to lose your hair. It could be devastating to have damaged hair, to have broken hair. It can be devastating to have patches of hair missing. And that full, luscious, shiny hair is known to project health and energy and youth and vibrancy. And a lot of people want that and want to preserve that. Part of my job as a dermatologist is to help hair loss. That involves an entire visit. I would talk about recent history, health problems, medications, stressful events, and take a very thorough history in order to evaluate what's going on with the patient. There are many reasons, systemic reasons for hair loss, whether it's anemia, vitamin deficiency, thyroid issues, and so on and so forth. It's up to me to uncover what's going on. A lot of times we do blood work. I also examine the scalp very thoroughly, try to look at some problem areas. I can get clues as to what's going on underneath and what's going on at the hair follicle level. Occasionally, what can be helpful is a scalp biopsy. I'll numb up the scalp and take a small core of tissue to send to the lab so that can be examined under the microscope and I can get a better picture of what's going on at the follicular level. Once we've established what's causing the hair loss, we can formulate a treatment plan. Now you can imagine that watching hair grow can be a very slow process, but I have found that it's very rewarding after 3 to 6 months to see the patient come in with fuller hair and their confidence restored. We have a lot of options these days. There are topical preparations that are great for hair growth. Everyone's heard of over-the-counter Rogaine. This is minoxidil. There's one made for men, another formulated for women, which is more dilute and not as potent. So I tell my female patients if they're gonna go that route, they should probably use the one formulated for men. I have other preparations where I can actually prescribe the minoxidil and it's prepared with other medications to make it more potent. So if this is what our patient wants to do, they can use this preparation. There are even essential oils that can help or natural ingredients that can help with hair loss. Rosemary oil has been shown to be just as effective as 2% minoxidil when used topically. So if the patient wants something more natural and they don't want to be using medication, they can choose to do that. Platelet-rich plasma has really revolutionized how we treat hair loss. It has been shown to increase vasculature, make follicles grow back thicker, and really bring back the hair if the hair has been lost by a process of pattern alopecia. This is particularly successful in the young male patients. A lot of them have very driven careers. They're in finance, they're on Wall Street. They don't want to lose their hair. So for these patients, they tend to do exceptionally well, thank goodness for them. And since they usually need upkeep 3 to 4 times a year, we do have long-term follow-up and they look great. Other things that we can use, there are certain nutraceuticals. These are Viviscal and Nutrafol. These are nutritional supplements with herbs that can help regrow hair and have it grow back fuller and healthier. There are certain oral medications But when you take an oral medication, it's very important to understand that you're increasing the risk of your treatment because you're taking a pill instead of applying something to your skin. If you take a pill, you are exposing yourself to side effects. Some of the most common pills that are used to treat hair loss in women are spironolactone. In men, we have finasteride. You can also add on oral minoxidil for men and women. Now, minoxidil, when taken in pill form, has side effects which can be serious. So this is something that you want to talk to your doctor about, not just your dermatologist, but also your primary care doctor. Make sure that they're on the same page regarding your hair loss treatment. Platelet-rich plasma is full of growth factors. So it's been used in medicine to help heal joints, and it's also used in aesthetics to rejuvenate skin. It can also help regrow hair. Platelet-rich plasma involves a blood draw, spinning it down, isolating the platelet-rich part of it, and injecting that into the problem areas. Usually people can experience a little bit of injection site pain, burning and stinging, and maybe a bit of a headache, but most people get over it just fine, and we still have a lot of people coming back regularly for their PRP injections. If you have any questions about anything I discussed, just leave them in the comments. Or if you want a consultation, give us a call and see me as a patient.